Hi, I'm Patrick Garvin. I'm an orthopedic sports medicine surgeon with Hartford Healthcare and the Bone and Joint Institute. I take care of patients anywhere from young patients to older patients with sports related injuries. So typically that involves injuries of the shoulder, the hip, and the knee. ACL injuries are still probably the most, common thing that we see a young high school athlete with. Shoulder dislocations can lead to shoulder labral injuries, and that can also necessitate surgeries. Those are two of probably the most common things I see in young athletes. And what we've seen a lot of is actually pickleball related injuries after falls, fractures, whether that's knee injuries or even a lot of upper extremity injuries, so rotator cuff tears and things like that. So I grew up with a lot of family members that are in medicine. My grandfather was a cardiologist. He was my first introduction to medicine. And so I was really kind of gravitated towards it at a young age. Most of my introduction to orthopedic sports medicine was rooted really in my own personal sports injuries. And I think it's very common for a lot of sports medicine physicians to have had a prior, orthopedic injury themselves. So I think I have an ability to empathize with people and kind of understand what they're going through with regards to their injury and how to treat them moving forward. Yeah, I mean, I think my biggest care philosophy with regards to taking care of any athlete really is to take care of them as if, I was taking care of my own family member. And it's really gratifying to see, someone who's completely debilitated by something, whether it's pain or dysfunction, now become, more functional, go through the rehab process after surgery and then return to the things they love to do. That's the most gratifying part. I think open communication between providers is really important, and it kind of allows us to really focus on taking care of the patient as opposed to some of the other kind of outside noise that we have to deal with on a daily basis. So outside of medicine, I really enjoy spending time with my family. I think family is a really big part of my life. I enjoy everything that New England has to offer in terms of hiking, biking, and spending time outdoors.